Well, good afternoon, everyone. We're going to go ahead and get started. I'm Mike Bermersky. I'm the superintendent of the Hempfield School District. It's great to have you joining us today. We are extremely proud of our partnership with Penn Medicine LGH as we've worked very hard this summer into opening schools in a safe manner. And it's because of the partnership and with also the support of our county commissioners that they were able to allocate federal dollars, the CARES funding, to make sure that schools here in Lancaster County had the ability to have medical experts working with us to work side by side to make sure that we can not only open schools safely, but keep the doors of school open for our students. So we've been providing these sessions we did some this summer and we're bringing them back to you now, wanting to make sure that we're providing updates across the county. So we're recording all of these sessions. And if for some reason someone is not able to join, I do send the links out to the other school districts and the superintendents, as well as we send these to the non-public schools. So without any further ado, we're thrilled to have Dr. Martin with Penn Medicine Lancaster General Health. Dr. Martin is the medical director of Lancaster County's contact tracing program. He's also the chair of the Department of Family and Community Medicine with Penn Medicine Lancaster General Health. So with that, Dr. Martin, thank you again for joining us, and I'll turn it over to you.
Thank you, Mike, and hi, everybody. This is the second webinar that we've done this week, and we're going to attempt to kind of project and think about what might happen in the near future here as we enter the winter months. So I'd like to talk a little bit about what are the factors that increase and decrease our risk, both to the community and to the schools, and also talk a bit about how we can continue to support the school community while balancing some of the challenges that we see coming in the next few weeks to months. And I'll talk briefly too about what a vaccine, both COVID and flu vaccine, mean for our community and schools. So I'd like to start out just by basically stating that COVID-19, being that it's a novel virus, meaning that the human population and our collective immune systems have never really seen anything like this since it transitioned from an animal to human population, not even 1 year ago. December 1st, I think, was the first documented case in China. The learning curve has been quite steep, almost as steep as the surges that we've had over the last several months. Public health and science in general has taken center stage to inform, decipher, treat, and prevent spread with the ultimate goal of preventing health system chaos, morbidity, and death. So from a medical standpoint, this is how we have reacted to other worldwide health challenges and is really fundamental to what it means to practice medicine and public health. Inherent in this process is uncertainty. We have uncertainty around the modeling of future cases. What is the best testing strategy? What does having had the virus imply in terms of immunity? Is there mutations that are occurring within the SARS-CoV-2 virus that changes its virulence or infectivity? And what is the infection fatality rate? That's still a fundamental question we don't know. What effect do school closures have on the spread of the virus and so on? So there are many, what I would say are known unknowns. And frankly, we on the medical side and the science establishment have not always gotten it right. And this too is not unexpected and really reflects the nature of medicine and scientific discovery throughout history. Add to this uncertainty, the partisan or what I would term political discussions, which also is a natural part of what it means to be part of our community or to be a human being. And it's no wonder that confusion, division, and polarization seem to rule the day. So rather than make broad-based authoritative statements underpinned by, quote, fact, I think we would all be better off, whether you're a doctor, a scientist, a public health worker, a politician, a teacher, a student, to really, embrace and respect some of the uncertainty when we think about projecting what might happen as we enter the fall and winter season. William Osler, who was really the first academic physician from the mid-19th century, once said that medicine is a science of uncertainty and an art of probability. So I think if we don't embrace our own humility around what we're seeing and what could occur, then I think we won't be able to continue to move forward as well. So my attempt here is not to make broad statements, but to show you the data, the science, what we've learned, which is quite a bit over the past several months, and try to give you an idea of what we expect in the future. And I'm going to be using a SWOT analysis, so looking at our strengths, weaknesses, opportunities, and threats as we go forward. So let's talk again about the current state. So Lancaster continues to see the highest incidence of COVID that we've seen since springtime. So we're in the third surge. We certainly saw a higher incidence rate with the initial surge of COVID, but we're seeing a higher incidence rate right now than we saw in the middle surge. So the second surge, we didn't peak as high as we are right now. Over the past week, there's been 386 new cases, and that's similar to the prior week. And so the incidence rate has increased slightly to 71 per 100,000. Remember, 100 is the cutoff for high community spread, so we're rapidly approaching that. Not only are we seeing an increase in cases, so it's not just related to testing and finding more folks with COVID, but we're seeing the downstream effects of that in terms of increasing hospitalizations and deaths. So we always have to see those two linked together, and we know that it's not just that we're finding more COVID cases, we're actually having worsening COVID spread in the community, and more people are getting sick. So LGH has had an increase in hospitalizations. I'll go over that. There was 4 additional deaths reported the past week, with a total death count of 14 in October, and 442 deaths since the beginning of the pandemic, which is just in Lancaster County. And I think we can't forget the toll that COVID has extracted on our own county. The percentage of positive tests have increased. I'll talk a little bit about that. The turnaround time for community tests has increased as well, and I think that reflects many other places in the state as well as the country that are surging and relying on big labs to do testing. And then I'll talk about our contact tracing program. So let's start out by what is working well. I think, when we look at our county, we have a lot of strengths. I think contact tracing, being a unified and county-wide effort, is rather unusual in our state. We're one of only 2 counties in the Commonwealth out of the 58 that do not have a public health department that have a county-wide contact tracing effort. So I think that reflects a lot of goodwill from not just the health systems, but the community as well to be involved in that effort. Schools have engaged with the health systems in an unprecedented way, and a lot, we have to thank Mike and all the other superintendents of the school districts to realize that we really needed to be unified, come together, have standardized workflows, algorithms, processes, come on the same page about frequently asked questions, and we have really done that. And I can't remember a time in my 25 years in clinical medicine that there has been engagement on that level. The clinical and public health guidance and frankly, the communication between schools, health systems, providers, the county government and the state government are aligned. And although it's not perfect, again, it's the best that I've ever seen in my 25 years or so in Lancaster County. The testing turnaround times are better than the national average, even though we've seen a bit of an uptick. Nursing homes and other congregate settings like personal care homes, shelters, and schools have embraced the guidance. They've learned how to mitigate risk. They've learned how to contact trace, which is something that a lot of the schools didn't think they would be able to do within their own facilities at a level that we didn't really think was possible. Cases in both the K-12 and postgraduate institutions have largely been a non-story. I just got word today that Franklin and Marshall, which has been doing surveillance testing, is not finding a lot of cases right now. And from what we're hearing about outbreaks in other places around the country, that's pretty remarkable. Lancaster County over the past month, despite seeing an increase in cases and hospitalizations, is below the Pennsylvania average. And that's really the first time we've been below the Pennsylvania average since the beginning of this pandemic. So here again is the current incidence curve. Lancaster County is the orange line. PA average is blue. And so you can see plenty of other counties in our state that are doing worse. However, if you look just at that orange line, there is an inexorable rise over the past couple months, and we are now at a rate that we haven't been to since April of last year. The percentage of positive tests have gone up. They increased pretty dramatically at the beginning of October, and that was when we started to test asymptomatic contacts. So we're identifying the cases out there. And it's really important to identify those asymptomatic contacts because if they're positive, then we can institute contact tracing and further decrease the spread of the virus. Now, I should say that there are subsets of the percent positive rate that don't look as good. So this graph that I'm showing you is actually all the tests that are done in Lancaster County. So it includes a lot of testing where there's a very low risk of positivity, and that would be pre-procedure testing. We test everybody when they come into Women and Babies Hospital for labor, for example. So when we remove those very low prevalence populations, our percent positivity rate is actually quite a bit higher than what the county is reporting out. So if we remove those various populations with low incidence, our percent positivity rate is actually 10 to 11%. And that is a fairly dramatic increase over the past several weeks. It had been 5%, but it's basically doubled. So what has not been working well? These would be our weaknesses. So I always don't like to see hospitalizations and deaths increasing. I mean, that's obviously a sign that COVID is rampant in our community, and it is putting pressures on the health systems. Again, the percent positivity among symptomatic persons and asymptomatic contacts has doubled in the past few weeks. Social distancing has been poor since the beginning of the pandemic and remains poor, even in comparison to surrounding counties. The R value, or reproductive number, and I'll talk a little bit about that, has consistently been above 1 for the past month. We've never had consistent elevation in that number for the length of time that we've had it just recently. Basic mitigation advice like mask wearing, social distancing, good hand hygiene, and limiting gatherings, I think have been distorted. So it's been politicized and it's been lost amid partisan rhetoric. So no longer are these public health measures that everybody needs to do to stay well and keep themselves well. It's been co-opted, I would say, by political and partisan forces. The link between school and community spread has been misunderstood. That's one of our weaknesses, and I'll talk about that. So let's talk about hospitalizations and deaths. So you may not know, but Lancaster General, of the other 6 hospitals in the Penn system, including Philadelphia, Princeton, Chester County, for the past 3 months or so has consistently had higher numbers of COVID patients. I think this represents the fact that we take care of a large portion of our county. So not only have we had more COVID cases than even some of the big Philadelphia hospitals, we've seen a steady uptick on top of that. And not only are we seeing a steady uptick in COVID patients, but we're seeing a growing hospital census that we normally see this time of year as we enter flu season. So currently we have 23 inpatients. 2 of those are on ventilators, but our ICU capacity continues to be stretched as there's a lot of non-COVID cases that are being admitted as well. So social distancing, travel to non-essential businesses in the past 7 days. This is data that looks at publicly available GPS data to see if people, how often and where they are traveling to non-essential businesses. And again, our social distancing rate is poor compared to all the counties around us, and it's gotten worse. So if you look at the curve, really from August, you can see a steady uptick. The dotted line is really the projection of cases that can occur because of the poor social distancing. I'm not sure why this is happening. It continues to happen, and it definitely concerns me. Along with the poor social distancing is our R value has, as I mentioned, been consistently above 1 for the last 6 weeks. So again, the R value is the number of persons that each person can infect. So one person that has COVID, the R value or R naught value is the number of cases that each person can infect. It's different for each virus. And you can see for H1N1 what it is, Ebola, COVID. If you do nothing, one person usually can infect 2 to 2.5 people. We need to have that R value below 1 because if it's not below 1, it means the cases will increase. If it stays below 1, cases will decrease. And I think that our R value, we've had peaks above 1, but they've always come back below 1. Having it be consistently elevated, I think, is directly related to the lack of social distancing, the fact that people are starting to gather again in both small and large family gatherings. I think there's high risk behaviors such as going to certain locations that would increase your risk, and lack of mask wearing, and frankly, virus fatigue. People are wanting the pandemic to be over. But what's happening is that it's driving our R value, which in turn drives cases. So again, the graph on the left shows you what happens when you have differing R values. If the R value is below 1, like 0.9 or 0.5, you can see the curves are much more shallower or are also decreasing. If it's above 1, you see increasing rates. The graph on the right just basically shows over the entire course of the pandemic what an R value will do. And again, we tried to flatten this curve, and the reason we did that was we just weren't prepared on the health system side to take care of everyone that would have presented to our health system if we didn't get that R value down. So I think what's fascinating is if you compare the social distancing curve on the left and the R value curve on the right, they're remarkably similar. And I think what this means is that our community, in our community, the lack of social distancing, travel, family gatherings, et cetera, are driving more community spread. And the projection of cases is for a continued steady rise. And really the only way to stop this is to get this R value number below 1 and to double down on what we've been doing in the past, including limiting gatherings, wearing masks, practicing social distancing, et cetera. So I always can't let a webinar go by without reinforcing all the things that we know work, including physical distancing, mask wearing, and good hand hygiene. Again, I'd like to remind everybody it's not where you go, but it's what you do when you get there. So I think a lot of Lancaster County is beginning to engage in these medium high and high risk activities. And as I identified on the webinar a couple of days ago, we do have some good scientific data that restaurants, bars and coffee shops, gyms, and religious gatherings are high risk activities. This study was done back when there was still a lot of stay at home. And so I think that when they repeat it, it's probably going to even be, in higher risk categories. Family gatherings. So this graphic represents one family gathering from 4 different households. So 4 different households came together, and all those in the family gathering are represented on the gray circle. All those outside of the gray circle are those who were infected as a result of this family gathering. So you can see that not only did the gathering put those at risk within the family, but it created significant community spread to those outside the family as well. So it's one thing for a family to decide to gather and accept the risk for those who are gathering. I've heard of other families that say, well, we want to get together and we accept that risk. The problem is it's an entirely different calculus to put the community at risk who did not consent to that family gathering. And that's what's happening. So you see this family gathering, and what happened there was these folks that were part of this family gathering returned to the regular activities. They infected coworkers, they infected other family members that did not attend the gathering, they infected their friends and their friends' children, which potentially could bring it into schools, et cetera. So it's not just when you decide to gather that you and the people you're with are accepting the risk. You're basically making a decision for the rest of the community. And the rest of the community is at risk once you leave that gathering, especially when you're in the asymptomatic phase of having COVID. So what about the link between community and school spread? I think, it's safe at this point to say that the majority of spread in schools seems to occur due to what's happening in the community. The more the community relaxes social distancing and the other mitigation measures, the more COVID comes into the school. On the other hand, it doesn't appear, and there is some good scientific evidence that backs this up. It's not perfect evidence, but there is some evidence that schools do not seem to be responsible for as much spread in the community that we once thought they could be. So what schools practice regularly should be something that we all practice. They're doing something right. It's kind of remarkable that there haven't been larger spreader events because of having all these kids and staff and teachers packed into schools. We would have expected to see more of that. And as I said, it's sort of been a non-story. Now, this could all change as more children come into school for learning. So as we increase the number of kids and the density of kids in each classroom, as we move to more in-school spread, this could change. And schools could become more of a nidus for spread and infection. So what are the opportunities? Well, since our social distancing is poor, I think that we can practice more social distancing and mask wearing. We should be doing what we're taught at our workplaces, at our school, and continue to do those same things when we're at home. There's nothing magical about preventing the spread of COVID, and we all know what we need to do. We just need to make sure that it's consistent across everything that we do, both in school, in work, and at home in our community. I think we need to continue to limit family gatherings and other high-risk activities like religious services, restaurants and bars, gyms, parties, or any other event where those outside of the same household gather. Now, it's another thing for those who are within the same household gather and do things together. They're in a bubble. That's an entirely different calculus than bringing in others from the outside. And I think we need to really encourage everyone to not only think about getting vaccinated to COVID-19 when the vaccination comes out, but also to get vaccinated against influenza. I'm seeing a lot of folks who are refusing their flu shot, and I think it's part related to the rhetoric we're hearing about how the COVID vaccine may not be safe. The flu vaccine is a very safe vaccine, and it seems to be a good one this year, and actually is targeting the influenza virus subtypes that are circulating. So right now, in terms of the coronavirus vaccine, we started out with 34 vaccine candidates in phase 1 trials. That's been whittled down. There are actually 6 vaccines that are in limited use. These are mostly vaccines in China and Russia. None of them are in limited use or approved use for the United States at this point. We continue to hear a lot of discussion about that. I don't think we're going to see any significant COVID vaccine until certainly early next year, and probably not widespread distribution until well into 2021. Here is a graphic that just kind of is from the CDC that discusses really how this should be rolled out. Vaccine distribution needs to be rolled out to those who are on the front line, those at highest risk, but also not only due to your job, but potentially because of where you live, or if you live in a high density setting. And so it's really important to keep social vulnerability and health equity as an important standard when we roll out these vaccines. So what are the threats? So I think more in-school education, less space, potentially more spread could be considered a threat over the next weeks to months. I think holiday and family gatherings are definitely threats, and we are seeing cases related to those, again, not just within the family, but outside. The twindemic of flu and COVID, and the potential for co-infection, which makes it kind of hard to fully understand, does this person's symptoms, are they related to COVID? Are they related to flu? What is going to be the underlying clinical issues that can come? There is some evidence in other places around the world that if you're co-infected with flu and COVID, you have a longer hospital stay, you have more severe illness. I think college kids returning home are a very real source of injecting more COVID into our community. Even if these kids take a test before coming home and they test negative, I would recommend that anyone coming home from college practice a modified quarantine within your household for 14 days when they enter the family bubble. And this basically means they remain socially distanced, everyone wears a mask, and there's as little interaction as is practical. Let me just share a little bit about family gatherings. So we're not going to have Thanksgiving this year. Typically, 5 of households from my wife's family come together over a big table. There's 22 of us. We stay in the same small cottage for my in-laws, usually for about 6 to sometimes 10 hours. It's a very meaningful event. It's something that we've done every year for at least the past 35 years. And we've decided that it's just not worth the risk. It's not worth the risk to our own family, but more importantly, it's not risk to our community. And that's the calculus that we have put around family gatherings. We haven't yet discussed the holidays, Christmas, and so forth. And I'm sure we're going to need to have a discussion related to that. So this is just a map looking at college campus outbreaks as of October 13th around the country. So again, there's not really a college or a university that has been immune from COVID spread. And again, all these kids will be traveling after probably just before Thanksgiving. A lot of them will stay in our community until through the holidays and return back in January. But a lot of these places are in places of the country where COVID is surging. And then these kids will be entering back into the family bubble. And I do think that thinking about modified quarantine in your own household when a college member, a child returns back as part of the family is really something that's going to be important to do. So in summary, there are many factors: increased cases, our poor social distancing rates, the holidays coming up, family gatherings, college kids returning home, increased in-school learning, and frankly, virus fatigue that are concerning for what we will face in the next few weeks to months. We have come together as a community to institute some effective protective measures, but it may not be enough to keep the spread of COVID-19 under control. I honestly believe that we are below the PA average at this point, in part because of our great partnership with the schools and also with the county through contact tracing. But there's only so much that can do to keep COVID under control. And right now we need to step up to begin doing all the mitigation measures necessary to keep ourselves, our families, and our communities as safe as possible. We should at least be practicing social distancing on a level of what our neighboring counties are. And ideally, it would be even better to see it better than that. So the final words, Dr. Hans Klug from the World Health Organization says, "The virus has been merciless whenever partisanship and disinformation prevailed. Where the pandemic goes from here is in our hands. We have fought it back before and we can fight it back again." And I think that's right. During the second surge, we didn't see as high of incidence rates, and that was because people understood that they needed to do the things that protect themselves, their family, and their community from the virus. And then our own Brenda Boucher, who's been working very closely with Alice Yoder and myself on this project. She says that prevention looks like overreacting when it works. Even those who are on board with public health measures are getting pressure to ease up, when it's actually those prevention behaviors that will allow us to keep life as normal as possible for businesses and schools. And I think she lays out very nicely what the catch-22 is. So it's not that because prevention works, then we can stop doing prevention. We need to continue to do that because that's exactly what's going to mitigate the threats that we see coming in the next few weeks and months. So thank you very much. I will stop there and take any questions that people might have.
Great, thanks, Dr. Martin. And for all of our attendees, if you have any questions, please feel free to post those into the chat box, and we can engage in a little Q&A session at this time. All right, well, I'm not seeing any questions popping in. So with that, Dr. Martin, I want to thank you for your time. Thank you for your willingness to continue to update all of us across the county on how we're doing here in Lancaster County with regards to COVID, particularly as we're working in the schools. And again, on behalf of all the superintendents, all the districts, thank you to you, to your team, Alice, and everyone on the team, for all the help and support that you've given all of us so as we've worked to reopen our schools in a variety of ways. And I think one of the most important things for our attendees to hear is the importance of not comparing schools. Every school is different in terms of their context, what they're able to do based on staffing, based on the protocols, based on space. So know that we're working hand in hand with our medical leaders here in the county to make sure that we can continue the best we can. So again, Dr. Martin, thank you, and look forward to future webinars.
Thank you. Stay safe, everybody.